for cancer
Right.
as well. So let's dive deeper into that. Um, so, what do you believe people can do to prevent cancer, and how early do you start?
Okay, great question. There are people, the important thing is to know there's a lot of people working on this question right now. We have Dr. Neil Barnard from the Physicians Committee for Responsible Medicine, who's doing a lot of research on nutrition and either preventing disease, whether it's heart disease, diabetes, obesity, cancer, or reversing that disease through diet. And then you have obviously Dr. Dean Ornish, who's been working for many years on preventing and reversing heart disease. But then, truly, if we're going to prevent cancers, where we really need to be starting is with our grandparents. And you're probably thinking to yourself, Aurelie, what are you thinking, grandparents? They were born many years ago. But if you look at the research that's being done, it turns out that our grandparents have a great influence on our own health and our own life. And in terms of the field of epigenetics, this is something that we're learning more and more about every day, that there's environmental factors that with our grandparents that influence what happens in our lifetime. So it could be famines, it could be chemicals, it could be pesticides, it could be endocrine disruptors, it could be plastics, even stress, they're finding, can influence what happens, for several generations down the road, because the DNA, there's little histones that can be, affected around the DNA that can turn the genes on or turn the genes off in subsequent generations. And obviously, what happened to our grandparents, we have no control over. So, if we haven't had, and there are studies that have been done, say, on famines. There was a group of researchers from Sweden, Kati, Bygren, and Pembry, did research on women whose paternal grandmothers were healthy during conception and pregnancy, and then as they were growing up in their early childhood, they had access to, adequate food and nutritious food, and they had a reasonable weight. They weren't overweight, they weren't underweight, but they had a reasonable weight. Their granddaughters actually lived longer, healthier lives. And when they looked at the paternal grandfathers, when they had adequate and nutritious food during their growing up years as children, the grandsons actually had longer, healthier lives too. So nutrition in our grandparents matters for our own health.